So going back to the anterior aspect of the forearm, in terms of movements, it carries out wrist flexion. So that's the flexor carpi, ulnaris and radialis. Flexion of the digits, so flexor digitorum superficialis and profundus. And it carries out pronation through the pronator teres and the pronator quadratus. In terms of innervation, it's pretty much mostly median nerve. So if you look at the diagram, and you can see I've circled it here, so the median nerve innervates most of the lateral aspect, and the ulnar nerve supplies some of the medial aspect. So both nerves come through the anterior compartment. The ulnar nerve only supplies the flexor carpi ulnaris, which is fairly easy to remember, I think, and it importantly supplies half of flexor digitorum profundus. So it supplies the medial aspect, which is also the ulnar aspect of the FDP. That means that when you try to flex your little and ring finger, you're using the ulnar nerve because that is the half of the FDP that is being supplied by it. And when you flex the middle and the index finger, you're using the median nerve. And again, that will become relevant when you think about nerve palsies.